So I just saw a patient who his story kind of infuriates me. This is one of my pet peeves. Hello, my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, and I specialize in genital reconstruction. This particular gentleman underwent an orchiectomy for cancer in his early 40s. Now he's 46, and he told me at the time when he had his orchiectomy and he inquired about getting an implant that he was too old in his early 40s and he was married, and why would he want to have such a procedure? So therefore, obviously, thankfully, he had his cancer successfully treated, but he expressed to me that the lack of a testicle on that side was a constant reminder of his loss. And really, I talk about this a lot, that I feel men have been left behind when it comes to reconstruction for testicles. Many reasons testicles may have been removed. They may not have developed properly at birth. Trauma, cancer are other reasons. Infections can sometimes shrink them as well. And unlike breast reconstruction, where we have tons of different techniques, different options for women, and it really would be blasphemy not to even offer a reconstruction here in the United States to a woman undergoing mastectomy. Well, the men oftentimes, are kind of left in the dust a little bit. And there's one particular study I read showing that 40% of men aren't even offered this, when we have good, robust data that this is indeed a medically necessary procedure for many men who have feelings of loss after surgery. And there is good data that a prosthesis can help with this. So, that being said, let's talk about what we do in our practice for testicle implants. So if you look at the data out there with the long-term results of patients who have had testicle implants, there's a few themes that come up. The top 3 complaints men usually have is 1, the implant can be too firm, 2, the implant rides too high in the scrotum, and 3, that the implant does not match the other side. So getting these things right, I believe, makes all the difference, and that's why in my practice, I no longer use saline implants. We've switched exclusively to the newer, extra soft silicone devices. So let's talk first of all about firmness. There's one study out of Scandinavia showing that 60% of men with silicone implants complained that they were too firm. Another study, for example, showed that up to 10% of men may have noticed some discomfort during sex because that implant was too firm. And it's very obvious when you put the implants next to each other that silicone implants are much softer. The newer devices are made of extra soft silicone elastomer, meaning that there's no gel in there, so unlike a breast implant, it can't rupture, and these devices are really designed for lifetime use. Getting an exact size match with a saline implant is pretty impossible sometimes because they only come in certain sizes off the shelf. And the irony is, if that testicle was removed, especially earlier in life, it usually grows bigger than a normal testicle in order to compensate as it's working harder. So a lot of patients will complain that their prosthesis is too small and doesn't match the natural size. We do not have this problem when it comes to silicone implants because we have 5 different sizes that are available off the shelf, and if those don't match exactly, we can custom make an implant. With our patients and the engineers, we will do renderings, we'll get the exact size, weight, the patient will approve them before surgery, and I find that this leads to really high satisfaction and an excellent match to the testicle that remains. So if you remember, the third most common complaint with a testicle implant is that it sits too high. This one can be a little bit more challenging. However, there's certain things I do in my technique to ensure we'll get it at the right level, if at all possible. So the first thing we do is I never tether the implant. Some of the saline devices have a little tab on it, and the surgeon will connect it to the scrotum. This can lead to unnatural dimpling, and the implant ending up in a strange position relevant to the other implants. When it comes to breast implants, for example, we learned years ago it's not a good idea, and we want a free floating device in there that can move around and act naturally like a testicle would. The second thing I do is I place the implants via scrotal incision low down, because this is where we want this implant to end up ultimately. And so we'll do a small incision, usually about an inch big, depending on the size of the implants we're using, and put it in the right place to begin with, which helps. Initially, it's normal that the scrotum will be tight, and some of the wall of the scrotum is made of muscle actually, and it will tend to be tighter in the first few months after surgery, but in most cases it will relax down to a very natural position. Overall, this procedure is safe, it's low risk to the patient. There is about a 2% chance of complications. I have other videos about that. So therefore, it's very rare that I turn a patient down for this surgery, especially I would never dream of turning down a man in his early 40s, because that is young and it's none of our business whether or not the patient is single in the first place. So we're accepting consults for this surgery. Usually we'll start out with a virtual consult. I'm based here in Miami, Florida, but we do get patients for all over the world for this procedure. If it's something you're interested in, please reach out. Usually the best way to get us is via the contact us in the button in the website. I've put that in the comments or in the section below, and we'd be happy to hear from you. Ask any questions in the comments. I'm also happy to answer those also.